Namaste, Sasrikal, Assalamualaikum. Welcome to another episode of Ask Dr. Sandy. And today we're going to be focusing on how exercise, yoga, and stretching is powerful, but we want to have an aligned system. So what I have here is actually a spine. And what happens is sometimes if we have health issues, people will ask me questions about stretching and exercise, which are great things, but we want to have proper alignment. So as you can imagine, if this system has actually shifted like this, and someone were to lift weights, if someone were to go running and the system is offline, you're putting pressure on the spinal cord, which affects every function in the body. And the big thing that's really powerful about chiropractic, as much as we want to help the muscles, we want to rejuvenate the organs. And as you can imagine with a structure like this, the exercise can actually aggravate the system. So what we're saying in chiropractic is let's take a break, let's get things balanced, gently over time start to take that spine, get it closer to alignment, and then you can do the stretching and then you can do exercise, because we have to be safe. And if I can make some recommendations, if you have a history of lower spinal issues, which those back issues can lead to bladder issues, digestive issues, numbness in the legs or knees, I would recommend, if you are working out, avoid things where you're jumping up and down, anything where you're bouncing, anything like that. Skipping would be tough, but anything with the jumping up and down can be very hard on the disc. I would also say, if you've ever had issues with the lower spine as well, be very careful when you're biking for a long period of time. That can squeeze the disc, and again, digestive issues, bladder issues, everything in the leg. And then long term, what can happen is if the spine's not taken care of, usually medically they'll recommend some kind of medication. If that's not taken care of, possibly that could lead to some kind of surgical intervention. So you want to look for something conservative. And in chiropractic, what your doctor will do is a proper x-ray assessment. They'll use some computer technology to see the health of the spine. And with that data, the chiropractor can very gently and precisely get that spine into place, take pressure off the nerve network so the body can start to heal itself. And again, for all of us, if we actually maintain the spine, what's exciting is that in your later years of life, and I talked to a patient about this, as you get older and your responsibilities might be less, you might be working, but you might work part-time or you're doing less, you should actually use that time to be more active. So there's an older philosophy that would say that, okay, I'm getting older, I should slow down. What we teach patients is maintain the spinal column, maintain the nerve network, and as you get older, now that you have free time, you should exercise more. Probably didn't have time when you were working. More fit, more exercise, more cardio, more resistance, of course working with your healthcare practitioner, but it's a beautiful way with chiropractic to correct the spine, maintain it, so as you get older you can have independence. The big thing, if you look in any chiropractic office, they want their patients to be independent, dressing themselves, driving themselves, doing the things they want. That to me is actually the true definition of health. How independent are you? Or do you need someone to prepare your food, help you dress, just do daily activities? These are things that the chiropractor strives to achieve, where you're healthy, independent. And what's exciting is when you work with patients, depending on the health level they're at, you work on recovery, strengthening, conditioning. But then what I like is at the higher levels of health, by maintaining the spine, you start to look at optimal performance. Now you're asking different questions and saying, okay, what can we do to enhance energy? How about mental performance? What can we do to make the body even better? If we're doing certain tasks, can they be completed faster? If this person is doing so well, can we add more to their day? So the spine is something that should be corrected. It should be maintained on an ongoing basis, and it can actually start as young as a child. We've actually had younger people come here all the time, and then even older people throughout your life. It should be maintained for a lifetime. So God bless you. I'll be here next week with another episode of Ask Dr. Sandy.